There is a grouping of diseases, adult CF, Cooley's anemia, hemophilia, sickle cell, which had funding a little bit over $3 million last year, which the governor's proposed to put them all together and call it disease management and have the funding at $2.6 million. And it may not sound like a lot of money or be a big deal to a lot of people, but in my household, it's a huge deal because my wife works as a cystic fibrosis research clinic, and if I don't ask this question, she may change the locks on me before I get home. So I really wanted to know is, first off, is there any type of synergistic qualities of combining them all into one line item? And secondly, which I don't think there is, but secondly, in the governor's budget book, it also notes that the $400,000 reduction should come from, drumroll please, cystic fibrosis. So I was wondering why my disease got singled out.
So this year's is not that different than last year's. The name of the grouping
which
changed.
we reverted back to the individual line items.
That's correct. So as you know, the governor's budget is a starting point for robust negotiations with the legislature, and we'll be pleased to work with you for a fair and equitable budget, ensures the health and safety of everyone in Pennsylvania, and we're pleased to collaborate on that.
I can guarantee I will robustly negotiate
and we're
that.
pleased to work with you.
You hear that, dear? Changing gears, Secretary Smith, in late last year, Governor Wolf accepted or talked about a $10 million grant from the Bloomberg Philanthropies in regards to opioid prevention and treatment. And I believe it said it was for hiring and embedding technical support staff and consultants, as well as assessment. I'm just trying to figure out this $10 million. When's it coming? Did it come? And why don't we see it anywhere in the budget book, anywhere that I can find? So can you tell me first off, when are we expecting this?
Yeah, that's a great question. So this isn't a grant in the same way that we receive federal grant funding.
Okay.
So they're not handing us $10 million. They're giving us $10 million worth of resources.
So they're giving you personnel.
Actually, yes, they're actually providing staff, embedding staff, paying for research, et cetera, in the amount of $10 million. And so to your question about the status of that, we spent a good part of December talking with folks from both Bloomberg Philanthropies as well as Vital Strategies and CDC, who are their partners in this funding effort, talking about various ways in which providing technical assistance and doing research and providing outcome studies could be beneficial in many different places across the state. So where we are right now is that they've done a little bit of work on that. They've come back to us and said, you know, we have a couple of ideas of where we'd really like to spend it. It seemed to match fairly closely with some ideas that we had. So we're kind of putting the fine tuning on some of that, but it will be in a multitude of different areas. So it won't just be one or two things, but there will be some technical assistance provided at county levels. It will include the criminal justice system, so some support to probation and parole systems, things like that, some studies around confidentiality for individuals suffering from substance use disorder. So it's on a variety of different topics. Once we have that a little more firm, I'd be happy to share that with you.
Yeah, and I'm also curious as to the embedded personnel. Are we going to hire new people, or are they will not be state employees?
That's correct.
Okay.
They will not be state employees.
So we won't be faced with a similar situation when the grant dollars run out, that
That's
all of a sudden
correct.
we have these people and then we do have to come up with
But
funding
some of
for
them will be physically located in Pennsylvania. So they could be physically located with the county that they're designed to work with. They might be located in our offices if they're working closely with us, but they will not be part of the state's complement.
So as far as we're concerned in the budgetary process, this is actually a non-entity.
It's outside the budgetary process, right?
Thank you.
You're welcome.